Mesothelioma is a disease that remains hidden for decades, and when symptoms do appear, they're often mistaken for common ailments that most people dismiss as nothing serious. But there are three warning signs that should never be ignored, especially if you have a history of asbestos exposure. Catching these signs early makes all the difference in your quality of life and could potentially add years to your survival. Hi, I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. And today I want to tell you about the three most important warning signs that might indicate mesothelioma. Before we dive in, you need to understand something critical. Mesothelioma symptoms are incredibly easy to miss. The latency period, which means the time between asbestos exposure and when symptoms start to develop, is typically 20 to 50 years. You might have been exposed in the 1970s or 1980s and felt perfectly fine for decades. So if you're only now developing symptoms, mistaking them for something else would be a natural thing to do, especially because when they do appear, they're often exactly the same as common conditions. Shortness of breath? Must be getting out of shape. Persistent cough? Probably just a cold that won't quit. Nobody jumps to the conclusion that a cough could be a lethal condition. So mesothelioma symptoms are frequently thought to be bronchitis, pneumonia, or just normal aging until they don't go away and get worse. That's why people who've been exposed to asbestos need to be vigilant. Warning sign number one, persistent shortness of breath that gets progressively worse. This is the most common early symptom of pleural mesothelioma. At first, you might notice you're winded climbing stairs, but over time, just walking across a room has you breathing heavily. That's because mesothelioma tumors cause fluid to accumulate around the lungs. The fluid accumulation has a medical name. It's pleural effusion. When this fluid compresses your lungs, it makes it harder to breathe. The tumors themselves also restrict your lungs' ability to expand. Now, many conditions cause shortness of breath, but mesothelioma is different in that the breathlessness is progressive and gets worse and worse over weeks and months. It doesn't improve with trying to get into better shape through exercise or by getting more rest. It's often accompanied by tightness in the chest, and critically, it occurs in people with an asbestos exposure history. If you're experiencing progressive shortness of breath and you've ever worked in construction, shipyards, manufacturing, or served in the military, especially the Navy, make sure that your doctor knows about your exposure history and specifically tell them you're concerned about mesothelioma. Don't let a doctor dismiss it as just aging without ruling out this deadly disease first. Now, I'm going to interrupt my list of warning signs for just a second to remind everyone, if you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get our videos seen by as many people as possible. And if there's a topic you'd like to see covered or a question you'd like answered in a future video, let me know in the comments section below. Also, make sure to watch until the end of this video, where I'll tell you exactly how to access help and resources if you or someone you love has been diagnosed with mesothelioma. Now, back to the warning signs you need to watch out for. Warning sign number two, it's a persistent dry cough that just won't go away. We're not talking about a cough that lasts a week or two or three after a cold or a case of COVID. We're talking about a cough that persists for months, doesn't produce much phlegm, and doesn't respond to the medications or antibiotics you pick up over the counter or even ones that your doctor prescribes for you. A mesothelioma cough, it's caused by irritation from the tumors growing in your chest, as well as the fluid accumulation I mentioned before. As tumors grow and fluid builds up, your body tries to clear your airways through coughing. But with mesothelioma, the problem is in the lining around your lungs, not in your airways. So the cough doesn't help and it doesn't go away. Many patients report their cough being worse at night or when lying down. This makes sense because fluid shifts when you change positions. Here's why this warning sign is often missed. Persistent coughs are common and usually aren't cancer. Your doctor might prescribe antibiotics or an inhaler and tell you to come back if it doesn't improve. And you might feel a little better for a while, so you don't follow up. Months go by. Eventually, someone finally orders an imaging study, and that's when the real problem is identified. Unfortunately, that sometimes doesn't happen until years after the cough started. And that means that the tumors have continued to grow without anything to stop them. If you have a persistent cough that lasts more than 3 weeks, especially combined with shortness of breath, and especially if you have a history of asbestos exposure, insist on having imaging studies done. A chest x-ray is good, but a CT scan is better. It's pretty much the best way to detect mesothelioma early. Now, the third warning sign is unexplained chest pain or abdominal pain that doesn't go away. For pleural mesothelioma, it's a chest pain that's often described as a dull ache in the chest wall, shoulder, or even in the upper back. People developing peritoneal mesothelioma go through abdominal pain that's accompanied by swelling or bloating. In both cases, the pain has specific characteristics. It doesn't come and go like a muscle strain. In fact, it generally gets worse over time. Deep breathing or coughing can make pleural mesothelioma pain worse, and in peritoneal mesothelioma, the abdominal pain is accompanied by noticeable swelling from the accumulation of fluid. Many patients describe mesothelioma pain as being a constant ache that's always there in the background. It interferes with their sleep, it doesn't respond well to over-the-counter pain medications, and there's no obvious injury that caused it. Here's what makes this dangerous. Chest pain gets people thinking about heart problems, so they might go to a cardiologist or ask their family doctor for a cardiac workup. Unless you have a heart condition too, that's going to come back normal. It's the same with abdominal pain. It gets attributed to digestive issues. And when doctors are looking for something else, it takes a long time for the real cause to be identified. Now, having these symptoms does not mean you definitely have mesothelioma. There are legitimately a lot of things that can cause a cough or pain or shortness of breath, and most aren't serious. But if you have these symptoms, especially in combination with a history of asbestos exposure, mesothelioma needs to be included in your doctor's list of possible causes, and that means you need the right tests to be done. Proper testing? It means getting a chest x-ray as a starting point, though, like I said before, a CT scan is even better for detection. If imaging shows abnormalities, the next step is probably going to be a biopsy. It's really the only way to definitively diagnose mesothelioma at this point. Don't settle for the x-ray looks okay if your symptoms persist. Insist on a CT scan and consult a specialist if you need. So those are the 3 top warning signs. Persistent shortness of breath that gets progressively worse, a dry cough that won't go away despite treatment, and unexplained chest or abdominal pain that persists and worsens over time. If you're experiencing any of these symptoms and you have any history of asbestos exposure, take action immediately. Make an appointment with your doctor and explicitly mention your asbestos exposure history. Request appropriate imaging studies. If your doctor dismisses your concerns, get a second opinion. Early detection is critical. There are significantly more treatment options for mesothelioma that's diagnosed in stages 1 or 2, and better outcomes than when it's diagnosed at stages 3 or 4. Don't wait for your symptoms to become unbearable. Visit mesothelioma.net and fill out our form for a free information packet with comprehensive information about symptoms, diagnosis, and treatment, as well as legal options. You can also get immediate help by calling 1-800-692-8608 or using the live chat feature on the website. Remember to post any questions you have below, and as for me, I'll see you next time.